Society has deceived you for decades. You were told self-pleasure was shameful, that grown men, especially those past 55, should have abandoned such practices long ago. But here is what nobody revealed. Beyond 60, masturbation is not merely acceptable. Could determine whether you thrive or slowly deteriorate. I have spent 14 years treating men exactly like you. My name is Dr. Eva Hart and I am a certified urologist specializing in men's health after 60. I have witnessed the hidden aftermath of neglect, embarrassment, and false information. I have observed far too many honorable men struggle not from disease but from knowledge they were never given. Because here is the reality. Most elderly men masturbate incorrectly or, even worse, cease entirely. They fail to understand that your technique, your frequency, and your mindset can influence your hormones, your cardiovascular system, even your cognitive function. Yes, this single practice performed incorrectly can contribute to impotence, mental decline, and prostate complications. Performed correctly, it can elevate testosterone, enhance rest, and maintain your circulatory system vitality. This extends beyond mere gratification. This concerns preserving functionality, restoring intimacy, and resisting aging where it originates in your neural pathways. In moments, I will reveal 6 truths about self-stimulation that every man beyond 60 should have discovered years ago. But first, consider this. If one aspect of your routine contained the secret to enhanced health, improved mood, and greater energy, would you not want to understand what it is? Remain here with me. What you are about to discover might transform how you approach the next decade of your existence. Before proceeding, if you have not done so, please subscribe and activate notifications. This ensures you will never miss another frank, research-based health revelation created specifically for men at your life stage. If this message speaks to you, simply comment yes below. If not, comment no. Your responses guide me in developing content that genuinely benefits you. Now let us begin. Starting with the primary truth most men never discover until it has already created problems. Because your current masturbation approach, practiced for years or decades, might seem natural, even innocent. But after 60, what once appeared routine can silently begin undermining you. Here we start with the most ignored error elderly men commit regarding self-gratification. It is subtle, silent, and eventually costs more than you realize. Secret 1. Mechanical self-touch creates desensitization and dysfunction. Allow me to share something I wish more men possessed the bravery to discuss. Throughout my career, hundreds of elderly patients have entered my office, clearly embarrassed, gazing downward, speaking barely audibly. Eventually, when our conversation became honest, I would inquire, "Do you masturbate?" Almost invariably, there was hesitation. Then came the admission. "Yes, but sensation has diminished." Or, "I cannot climax unless I use a specific method." Or the most memorable, "My body seems to have forgotten how to respond." What they did not realize was that their masturbation technique, rapid, automatic, detached, had been conditioning their system toward malfunction. The results: silent, progressive, destructive. Mechanical masturbation transcends poor habits. Creates neurological conditioning cycles. Each time you rush the process with tense muscles, viewing intense imagery, employing identical hand movements, identical patterns, identical conclusions, you teach your brain to connect arousal with that precise routine. Unfortunately, brains learn quickly. What occurs over time? Sensitivity decreases. Erection quality begins deteriorating. You might discover you require increased stimulation, greater pressure, more techniques simply to achieve previous sensations. Responding to an actual partner becomes more difficult. You begin avoiding intimacy because it feels too different, too gradual, too genuine. This is where genuine damage occurs. Not merely physically, but emotionally. I have observed men descend into frustration, shame, depression, believing their bodies are defective. But frequently, their bodies are not broken. They are incorrectly trained. This conditioning can cause porn-induced erectile dysfunction, can also create delayed ejaculation or complete inability to climax. These conditions are not rare. They quietly affect millions of men. Cruel aspect is most never realize it results from their unintentional self-conditioning. But here is the worst part, and I want you to understand this clearly. When you condition your system this way without reversing course, you lose more than sexual function. You lose confidence. You lose connection. You begin retreating. Your relationship with your body becomes cold. You avoid touch and closeness. For many men, this isolation becomes the pathway to darker territories. Emotional distance, depression, even early cognitive decline symptoms. I have witnessed this repeatedly. Price extends beyond the bedroom. It affects your spirit, how you carry yourself entering rooms, how you stop examining yourself in mirrors. You slowly disappear. I am not here to shame you. I am here to awaken you. Positive news is your body can relearn. Your nervous system can heal. But it requires awareness, patience, and a new approach to self-pleasure. One that is slower, more conscious, more connected. Not just to sensation, but to emotion. Masturbation is not your enemy, but practicing it without awareness is like driving without steering. Eventually, you crash, and by the time you notice damage, repairs take far longer than anticipated. But here is something most men do not realize. While mechanical masturbation causes damage, something equally dangerous hides in plain sight. Something even quieter, more common. Society actually praises it. In the next revelation, I will show you why complete abstinence after 60 might be slowly sabotaging your health from within. Secret 2. Regular ejaculation prevents prostate stagnation and swelling. I clearly remember a man from several months ago. We will call him Marcus. He was 72, dignified, quiet, the type who avoided discussing personal issues. But he consulted me because he was awakening 4, sometimes 5 times nightly to urinate. He described pressure, fullness, a persistent ache deep within his pelvis. He assumed it was simply aging. What he did not expect me to ask was, "When did you last ejaculate?" He stared at me as if I had asked something inappropriate. "Years," he replied. "I have not been intimate since my spouse died." Honestly, I believed men my age should stop such activities. There lies the misconception that once you reach certain ages 65, 70, 75, you should simply shut down the entire system. But here is what I told Marcus and what I will tell you now. When you stop ejaculating, your prostate continues functioning, keeps producing fluid, and if that fluid remains unreleased, it accumulates, creating stagnant reservoirs within your body. That accumulation leads to prostate congestion, inflammation, discomfort, and eventually genuine health risks. Your prostate was not designed for indefinite fluid storage. When it attempts this, it becomes swollen, inflamed, irritated. You begin experiencing urinary urgency, weak streams, dribbling, even pain during urination or ejaculation. Most men attribute this to aging, but actually it represents a backed-up, pressurized system. Here is where it becomes serious. Chronic prostate inflammation has been linked to increased prostate cancer risk. I am not claiming abstinence causes cancer, but frequent ejaculation helps reduce inflammatory environments that can make prostates more vulnerable to disease. Furthermore, a comprehensive Yale study followed nearly 35,000 men over years and discovered those who ejaculated at least 18 times monthly had significantly lower prostate cancer risks than those who did not. This represents data, not speculation. Returning to Marcus. Once we discussed this, once he understood what was occurring within his body, he made changes. He began self-stimulation again. Not from desire or loneliness, but from care. Gradually, his symptoms improved. Pressure eased. Sleep improved. More importantly, something in his demeanor brightened. He reconnected with an aspect of himself he thought was permanently dormant. Neglecting this costs more than poor sleep. It means chronic discomfort, unnecessary medication, potential future surgery. Yes, it could mean higher cancer risk. All because of beliefs that men your age should no longer claim this health aspect. You would not ignore your heart or blood pressure. Do not ignore your prostate. What if I told you that emotional shame men feel about this, years of guilt, silence, discomfort about self-touch actually worsens physical symptoms? That is exactly what the next secret reveals. Secret 3. Embarrassment about self-pleasure harms mental wellness. There exists a particular quietness within many older men. I observe it constantly in my practice. It appears not in their words but in their silence. The way their gaze shifts when I ask about sexual habits. How their shoulders drop when masturbation is mentioned. How they laugh it off, change subjects, or tell me, "Doctor, that is not something I practice anymore. That was for younger days." But I hear the subtext. They did not stop by choice. Somewhere along the way, they learned it was wrong to continue. Let me be direct. This type of shame, quiet and unspoken, represents one of the most dangerous forces working against your health today. For decades, many of you were raised when self-touch was labeled dirty, sinful, weak. You were punished, ridiculed, or made to feel ashamed. Those early messages did not vanish. They went underground, settling in your nervous system, deep in your essence, quietly shaping your relationship with your body even now. The result is quiet withdrawal. You disconnect from physical touch even when craving it. You view desire as inappropriate. You stop reaching for yourself not because you do not want to, but because you have been conditioned to feel you should not. Over time, that disconnection becomes more than emotional. It becomes biological. Here is what most men do not know. Regular, healthy sexual touch, including masturbation, supports mental well-being in real, measurable ways. Regulates cortisol, boosts dopamine, fosters oxytocin, your brain's trust and connection hormone. It even helps with sleep, mood, cognitive function. But shame disrupts all of that. Shame tightens muscles, raises stress hormones, creates guilt cycles in your mind that you no longer notice. Shame is a stressor. Chronic stress links to anxiety, depression, heart disease, immune dysfunction, even dementia. I once treated a patient, age 69, recently widowed, profoundly depressed. He was not on medications, had no major health issues, but was exhausted, numb, isolated. He told me he had not engaged in any sexual activity with others or alone in over 8 years. I thought that phase was finished, he said. Beneath his words was quiet grief. Not for lost sex, but for lost self. We worked together slowly. No pills, no drastic changes, just simple exercises to reconnect him with his body without guilt, without expectations. Within weeks, something shifted. He began walking prouder. He slept better. He laughed again. His blood pressure decreased. He was not fixed. He was reconnected. That is shame's price. Takes your vitality one slow degree at a time. Tricks you into thinking you are too old to feel alive. But you are not. You are never too old to touch yourself with kindness, dignity, purpose. You are never too old to feel complete. Shame can cause such damage. Imagine what happens when hormonal decline adds fuel to the fire. The next truth is one most men never see approaching. Secret 4. Sexual activity stimulates testosterone production. I want to tell you something most men only learn when it is already too late. Something I wish every man beyond 60 could hear clearly without embarrassment or uncertainty. Testosterone, the hormone that powers your energy, strength, drive, confidence, and sexual desire, does not simply slowly disappear due to age. That is what you have been told to believe. But here is the truth I have learned after decades working with men like you. Testosterone also drops when you stop living like a man who still wants to feel vibrant. When sexual energy is ignored, suppressed, or buried under years of shame and inactivity, your body begins reducing its masculinity dial. It says he no longer needs this. It starts reallocating resources, redirecting hormones, slowing blood flow, conserving energy. Your muscle tone fades, your waist expands, your sleep worsens, and your spark, the edge that once made you feel like yourself, begins vanishing. Not because you are old, but because your body has stopped being reminded that you are still here, still alive, still capable of desire. I remember treating William, age 71, retired police officer, formerly all strength and presence. When he first came to me, he was hunched, tired, told me he had not felt like himself in years. "I am just declining," he said. But examining his labs revealed testosterone barely above clinical deficiency. When I asked about sexual activity, he shook his head. "I see no point anymore. That belief is the real threat. Not your calendar age, but the moment you stop seeing your sexuality as a living, breathing part of who you are." I helped William slowly re-engage, not with others, but with himself. Simple practices, no shame, just presence. Over the following months, not only did his hormone levels improve, but his posture changed. His voice carried more authority. He began exercising again. His eyes brightened when speaking. The body responds to what receives attention. When you ignore your sexual self, testosterone listens. But when you reawaken it, even through solo intentional touch, you signal your brain, "I still need this. I still want to feel." The brain responds by reactivating systems that had been dimmed for years. This is not just theory. Studies show short-term testosterone boosts following sexual stimulation, even solo. We have seen how erotic imagination, physical engagement, and anticipation can affect hormone regulation, mood, motivation. Your body is built to respond to pleasure, connection, presence. When you give it nothing, it slowly offers nothing back. Low testosterone has been tied not just to fatigue and sexual dysfunction, but to heart disease, diabetes, cognitive decline, depression, even shorter lifespans. This is not merely a number. It is a vital marker of how engaged you are with life itself. Most men never know how far they have drifted from themselves until returning feels almost impossible. But there is a way back, beginning not with medication or surgery, but with reclaiming your connection to your body on your terms, in your space, without guilt. Secret 5. Erection quality operates on use it or lose it principles. There exists a quiet falsehood many men embrace after 60. It sounds like, "If I am not having sex, I need not worry about erections anymore." I have heard this countless times, men dismissing concern about their function because they think they have aged beyond needing it. But let me tell you something most doctors do not say clearly enough. Erectile function transcends sex. Concerns blood flow, nerve health, cardiovascular integrity, longevity. I once treated a patient, Gerald, 67 years old, strong background, intelligent man, but he had gone 4 or 5 years without a single erection. Not because he could not, but because he thought there was no reason to. His wife had passed. He was not dating. He figured that life chapter was over. What he did not realize was that his body was not waiting for him to decide to return. It was shutting systems down. Here is what most men do not understand. Penis resembles any other muscle and vascular structure in your body. When used, tissues lose elasticity. Blood vessels stiffen. Oxygen flow decreases. Microtears and fibrosis, hardening of soft tissue, begins setting in. Eventually, even if you want to use it again, it does not respond as it once did. Not from age, but from disuse. When regular erections stop, smooth muscle in the penis begins atrophying. The delicate blood vessel network responsible for engorgement becomes less efficient. Nitric oxide, a vital chemical for triggering erections, diminishes. Here is the part nobody tells you. This happens whether you are trying to be sexually active or not. It is biology. If your body does not experience regular arousal and engorgement, it assumes the system is obsolete. Over time, damage is not just physical but psychological. As the body loses capacity, the mind follows. Confidence erodes, self-worth slips. You feel less like yourself, not from age, but because your body no longer responds to the identity you once carried. For many men, this leads to withdrawal, depression, even early cognitive slowing. I have watched this happen, not overnight, but slowly, quietly, completely preventably. So what can you do? Remind your body it still matters, that this system is still needed. You can do that without a partner, without pressure, without shame. Regular erections, whether through self-stimulation or non-sexual arousal, keep blood flowing, tissues oxygenated, neural pathways alive. This is not about chasing pleasure for its own sake. It is about preserving a core part of your physical health and identity. Maintaining erectile function is about more than sex. It is a message to your body that you are still engaged, still connected, still living. Secret 6. Digital stimulation rewires aging brains dangerously. I want to discuss something often left in shadows, especially for older men. Internet adult content. I know just mentioning this can make some of you uncomfortable, maybe want to look away. But if you are still here, I ask you to listen with open ears and heart, because what I am about to say could change how you view your mind, body, and masculinity. I have had men in their 60s and 70s sit across from me and admit they still view adult content. Not from obsession, but because it represents one of the few ways they still feel something. Many live alone. Some are divorced. Others are widowed. They are not chasing thrills. They are chasing connection, or at least its memory. But here is what almost none realize. The adult content available today differs completely from what they first encountered in their 30s. What used to be static images or soft visual cues has become floods of high-speed, high-stimulation, instant gratification content. The human brain, especially an aging one, was not built to process such overload without consequences. Every time you watch adult content, especially more extreme or fast-paced types, your brain releases dopamine, a chemical associated with motivation, reward, pleasure. But over time, repeated exposure desensitizes your brain's response to natural stimuli. It becomes harder to feel aroused by simple real-life touch. You need more intensity, more novelty just to feel anything at all. That is not about preference. It is about neurochemistry. Your wiring is being altered by repetition. When your brain is conditioned to expect artificial, exaggerated stimulation, your body follows. Erections become less responsive. Climax becomes more difficult. Some men develop complete digital content-induced erectile dysfunction where they can perform only with screens and not at all with real partners or in solo moments without it. This cost goes far beyond bedrooms. I have seen men spiral into shame, anxiety, frustration. They begin believing they are broken. They withdraw, feel defeated. Tragically, they never connect the dots. They never realize the very thing they turned to for relief was slowly robbing their vitality. But here is what I want every listening man to understand. This is not irreversible. You are not broken. You are retrainable. Your brain, even after 60, still has capacity to heal, reset, rediscover what real, grounded arousal feels like. But healing begins when you step away from artificial highs and allow your body to reconnect with reality, presence, sensation, imagination, and yes, silence. Some men choose 45-day breaks from all visual stimulation. Others ease in more slowly. What matters is beginning to rebuild your nervous system's relationship to pleasure on your terms. The goal is not giving up pleasure. It is reclaiming it, making it yours again, feeling something real. Your path back to authentic sexual response begins with one simple decision: choosing reality over artificial stimulation. If you have stayed until the end, I want to speak to you not just as a physician, but as someone who has spent decades sitting with men, hearing their concerns, their regrets, and sometimes their quiet hopes. What we have discussed today transcends masturbation. Concerns something much deeper: how you relate to your body, how you carry your history, and whether you are willing to believe your life, your sexual life, emotional life, physical life is not finished just because society told you it should be. We began with the truth that mechanical masturbation can slowly condition your body into dysfunction, that rushing through motions, disconnected and distracted, is not harmless. We examined how avoiding ejaculation entirely can lead to prostate congestion, inflammation, and sometimes even increased cancer risk. We discussed shame's silent poison: how many men carry guilt that is not even theirs. We explored how testosterone decline is not just aging but accelerates when you stop engaging your sexual self. We talked about erections as more than sexual function but signs of vascular health. We open discussion about digital content not for shame but to explain brain chemistry alteration. What I want you to take from this is simple: you are not broken. You are not past hope, and you are not alone. Every system in your body, even now, wants to respond to connection. Your brain still wants to feel. Your heart still wants to open. Your skin still wants to remember what it means to be alive. That journey back does not require anyone else. It starts with you. It starts with choosing to stop shrinking, stop apologizing for wanting to feel good in your own body, stop believing the lie that age makes you invisible. You are not invisible. You are still here. What you do with that matters. This is not just about reclaiming sexuality. It is about reclaiming yourself. And that starts right here, right now with you.